go. Now we're on. We're on live, and so I'm recording today's session, Sport 2 Prevention Plus Wellness Program, introduction to this program. So what I'll do is I'll walk you through the program manual so that you get a sense of it. So, and we'll also show you the PowerPoint slides. And if we have a little time, I could show you our resources on our website if you haven't been introduced to those. So that's what we're going to do today. So today's session will be 30 minutes instead of 60 minutes. It'll be a good introduction. So the Sport 2 Prevention Plus Wellness program is unique in that it's our only multi-session program. So all of our other Prevention Plus Wellness programs, whether they be Sport Prevention Plus Wellness as evidence-based intervention for youth, In Shape Prevention Plus Wellness for young adults, or our other PPW programs, vaping, marijuana, opioids, even our In God's Image program, all a single session screening and brief intervention. So those other programs all integrate the avoidance of substance use with the promotion of protective wellness behaviors, physical activity, nutrition, sleep, even stress control. Whereas Sport 2, which is what we're going to be discussing today, breaks apart those lessons and talks about those individual wellness lessons. So that's how that's the main difference between Sport 2 and all of our other Prevention Plus Wellness or PPW programs. So I'll walk you through this today. This is being recorded. Remember, after today, if you've registered, I will send everyone a link to this recorded session. I will send you a certificate with a half-hour CEU credit. You just type in your name and print out a copy for your record. So I will follow up with that for all of you today. If you do not get it, then it's likely it's been sent to your spam folder. Okay, so that's what we're going to do today. Before we launch into this, I just wanted to share something with you. Yesterday was a difficult training for me because I had mentioned to you, I just heard about my beautiful 32-year-old daughter. She's very healthy, and then she ended up having problems, having a high temperature, having problems breathing. So it was a very scary time for my wife and I yesterday, and a little difficult for me to go through the training. So, and I appreciate those of you that had reached out to me with prayers and kind comments. So let me just give you an update about a personal update on my daughter, because I think it could be instructive for some of you when dealing with this novel coronavirus. So my daughter Brittany lives south of us here in Florida. And she's very health conscious and very healthy, regularly exercises, eats very well, and so forth. Anyway, so yesterday she couldn't get out of bed. She was extremely weak, very sick, and most seriously and concerning me and her mother was that she couldn't breathe. So that was a scary thing. So a friend of her husband's, who's a physician, recommended that Brittany go into an emergency care walk-in clinic. And so I'm sharing this with you because you know, you don't know what to do if you think someone you know may have this COVID-19. Or is it just a flu? Or is it something else? So let me just share with you what we went through, and it may be instructive for some of you in the future, because we're all going to be impacted by this in our families and friends and so forth. So, you are supposed to go online and you report your symptoms, and then based on the symptoms, you know, supposedly you're directed to a healthcare provider if that's what's required. But there were some issues with my daughter. She didn't know she had a healthcare provider. She didn't need one until this point. And then when she did reach out to her primary care provider, they didn't respond. There was no answer. And so the recommendation from a physician, and also actually from my brilliant wife, was to really, Brittany needed to go in and see somebody about this. And so she went into a walk-in clinic, an emergency clinic, And they said, hey, listen, because of your symptoms, you need to go into an emergency room. So she went to an emergency room. They went there, they did a quick test of her, and they put her in an ambulance and they sent her to the hospital. So her symptoms were high temperature, problems breathing, and she also had a very high white blood count, meaning she had likely have some infection going on. Anyway, sent her to the hospital for some more tests, scan of her lungs, and so forth. And for 3 hours, they're going to keep her well. Again, very high white blood cell count, meaning she has an infection, problems breathing. They said, you're going to stay with us. So at the present moment, she's still in the hospital. They put her on a heavy antibiotic. And the good news is her white blood cell count has gone down. That's a good news. But even walking to the bathroom within her hospital room, she's laboring breathing. They did I don't know, a CT scan or a scan of some sort, MRI, I'm not sure which one, and nothing in the lungs. So that's where we're at right now. The point is, I think for a lot of you, is that there are different, and by the way, they gave her they tested her for flu, which came up negative. They tested her for the COVID-19, and it takes 10 days to find out what the results are, which is very problematic. So we're not going to know for another 9 days whether she has it, but in the meantime, it doesn't really matter because they need to treat what's going on with her. So it's very unlikely this is anything other than the coronavirus, but I want you all to know that, at least in our experience, this is not like the flu. This is a very serious thing. Not that the flu can't be serious, which it can be, especially for older people. My daughter has had a flu shot, so not the flu. And the most scary thing is that it's about the breathing, and that's very concerning. And that continues to be a concern to us. Her scan was clean. I don't understand at this point why she's still having problems breathing. So she's still in the hospital. Good news is that the infection is being treated by the antibiotics. So we're going to have a training tomorrow. If you come into the training tomorrow, I'll give you an update, and appreciate your prayers. And just wanted to share that with you because, again, I think there's a misconception and people don't know what to do if this happens. There's flu-like symptoms, but but also there's different symptoms. And again, from my perspective, that main difference is that very, very scary symptom of not being able to breathe. And so even now, Brittany is finding it very difficult and gets winded just walking from her hospital bed to her bathroom in the hospital. So the good news is she wasn't put in an ICU unit, but she was put in the next level unit and not a regular bed because they wanted to keep an eye on her. So this is serious stuff, even for a 32-year-old like my daughter who's very healthy. And so do not mess around with this. If you know somebody that has some symptoms, and apparently it looks like, based on the data that's being reported, at least in the media, 80–85% have very little or no symptoms from this. But there is a certain percentage that this can really, really have a negative impact on. Not sure why that is, why some people may be more vulnerable to it. But I just, again, wanted to share that with you. And I apologize for taking the time to do that. But I thought this is a very important lesson, and I wanted to provide that for you because, again, we're all dealing with this very extraordinary time in our lives where we have this pandemic impacting not just the United States, but the whole world. Okay, having said that, and thank you for allowing me to share that with you. Now, I want to, before I start showing you these slides, I'm going to ask you a couple of questions. I have a poll I want to post. And I think I have to stop sharing to put that poll up. There it is. So here it is. I'm going to launch the poll for you. You'll be able to see it. And there's just 4 questions. So this will give us a little sense of who's on today's session, and I do apologize. Yesterday was a little lengthy. Spent a little bit too much time saying hi to everybody who logged in. So you should be able to see these questions. You may have to scan down. Do you see them? Hopefully you do. I've got the poll launched, but oh, there we go. All right, there we go. Maybe it took a while. So take a look at it. You got 4 questions. Where do you live? You're just going to have one response to that. The second question is, which Prevention Plus Wellness program or programs have you used or plan to use? And so you could answer multiple items there. Question 3 is, what distance learning strategies are you or will you use? Let me ask again. Question 3 is, what distance learning strategies are you that's poorly written, or will you be most likely to provide used to provide prevention programs during COVID-19? I apologize for that. Obviously, it's poorly worded. And then lastly, the 4th item is, what do you need most to help you provide prevention programs during COVID-19 outbreaks? So those 4 items, I'm going to just give you a couple of minutes to answer those. This won't take as long as yesterday, where I just felt the need to say hi to everybody. So I apologize for taking so much time yesterday to do that. As you're completing that, let me just say tomorrow's it was supposed to be a training tomorrow in distance learning, how to provide prevention programs using distance learning. And it was meant to be a training. I thought there'd be 15, 20 people. We could hear each other, see each other, interact. Well, it's well over 100. So, and in fact, it's so far over 100 that some of you will not be able to log in tomorrow to this. And then I had to change it from a training session to a webinar. So tomorrow's session, same time, will be a webinar. And some of you will not get in because it's overloaded, it's overbooked. And so I'm having the same training offered next week, Wednesday. So don't worry if you don't get in tomorrow. Same distance learning training will be offered next week, Wednesday, and I'll send everybody a link to that who's registered for tomorrow's training. So if you don't get in tomorrow, no worries, you'll be able to get in Wednesday, and we'll offer that as often as we need to let everybody participate, because there seems to be a great interest in, everybody's locked down. So how do we provide these critical prevention programs, content strategies to our youth and young adults while we're doing this lockdown? What are the strategies? And we're focusing primarily on online and telephone. There are some other options, but that's what the training is going to be about. And that's going to be tomorrow. We're also going to offer that free training on Wednesday. All right, let me stop the polling and see how everybody responded to the 4 polling questions. So where do you live? So you have, it looks like most people in the Northeast. Well, that's probably because it's later on in the morning, but we do have some people from all, well, except for the Southwest, it looks like, and nobody from outside the contiguous US. Nobody from the West, nobody from the Southwest. So we have mostly Northeast and then Southeast, and some in the South and Midwest and Northwest as well. Welcome all of you from throughout the country for today's training. Secondly, which Prevention Plus Wellness programs have you used or do you plan to use? It looks like SPORT is that's the Sport Prevention Plus Wellness program, evidence-based. We have high school, middle school, elementary school versions. And then, but we do have others. We have Vaping Prevention Plus Wellness, In Shape, which is our young adult program, Marijuana Prevention Plus Wellness. We even have Sport 2, which is today's topic, and even In God's Image. So, and then there were some that said none of the above. Then we have on question 3, what's the distance learning strategies you'll be using? live online, by far, recorded content, and then some others. Now, I'd love to know what those others are. So if you don't mind, I'd love to hear from you. You could just write in, what are those other distance learning strategies? If you're not going to be using, or if you're going to be using something other than live online, telephone, correspondence, recorded content, what are those other strategies? I'd love to hear from you. You could just type it in or write it in your live chat. And then the last question is, what do you need most to help you with providing prevention programs during our outbreak? So you got training, prevention, that programs. Most of you wrote both. Most of you wrote training and prevention program materials. If you put other, love to hear what you need. So you can type that in as well. So those are the results. I'm sorry, I guess I may not have showed you the results when I was reading them, but there they are. You could see them all. You heard what I said. Thank you all for participating in that. And it gives me a little sense of who's online. So let's get to the content at hand, which is walking you through the Sport 2 Prevention Plus Wellness program. Let's take a look at the table of contents. There's 8 sections. In addition to the introduction and directions, the Sport 2 programs, which again, there's a high school, middle school, and elementary school version, has 6 lessons. So whereas our other PPW programs integrate all of these health behaviors within one lesson, Sport 2 separates them and addresses them individually. So as you can see, we actually have 3 lessons on different types of physical activity, moderate, vigorous, and muscle strengthening. Then there's a lesson on healthy eating. There's a lesson number 5, or section 6, which is actually on healthy weight control, or sometimes called monitoring food and calorie intake. And then the final 6th lesson is controlling stress. And then there are some evaluation tools that are built into the program, like all of our programs. So that's the difference. You have 6 lessons instead of a single lesson. Now, how is this used? Well, I would say most organizations, what they'll do is they'll implement sport, the original one-on-one session, evidence-based program, and then they will implement some of these Sport 2 lessons. So if you have access to young people, whether that be face-to-face, online, by phone, or whatever the case might be, and you want to provide more than one lesson, what you could do is you can provide sport, prevention plus wellness, and then you can provide up to 6 additional lessons if you use Sport 2. So that was the intention behind the development of Sport 2. It's a great program. I think you'll like what you see here. So I'm going to skip through the introduction and directions. This is the actual physical manual you get. Like all of our programs, you get a physical manual, and then you also get the digital downloads of the slides and all the reproducible materials, so you can implement it to countless young people. So just a single purchase, same price as all of our program, or most of our programs, $4.99. So let's just take a look as an example. We don't have time to go through all the lessons. We don't have time to, look at the high school version versus the middle school versus the elementary school. I will say this though. If you want more information about this program or any of our programs, we do offer 2-hour live training for program implementers. So it's a 2-hour live training. It costs $199. And if you want to really get into the specifics of these programs, that's what I recommend you do. You can sign up on our website, preventionpluswellness.com. Go to training, and the drop down will come down, and you'll be able to click on online program, PPW program implementer training, and you could identify and list that. So you can pick any you want. It's 2 hours live, actually 1 hour recorded. And because you're online, I'm going to give you a special price break, 15% off if you want to take a follow-up training, online 2-hour Prevention Plus Wellness Program Implementer training. So I'm going to give you a password, and if you order your training online and you use this password, this code, you'll be able to get 15% off your training cost. Full training costs are $199. You can get 15% off. And the discount code or the password is 15% off. Hey, who'd have thought it? 15% sign OFF. So that's all you have to do is type in when you order that, and you'll get 15% off your Prevention Plus Wellness Program training, implementer training. So let's say you wanted to take this training for 2-hour training for the Sport 2 Prevention Plus Wellness Program for high school adolescents. You go online, Prevention Plus Wellness, order it, and it'll come up and it'll say, what's your passcode? And you can put in 15% off OFF. All right, so first lesson, let's take a look at the first lesson, moderate aerobic activity. So you can show all 6 of these lessons. You can show whatever number of lessons you want, depending on your needs, the needs of your youth, whatever the circumstances are. So in other words, if you want to show, some of you might want to show the lesson 3, which is a muscle strengthening exercise. Some of you might not want to do that. So it's completely up to you. It's very flexible and can be tailored to your needs and the needs of your young people that you serve. So again, this is the lesson on moderate aerobic physical activity. And it starts out with the screening survey. And let's just take a quick look at the questions. These screening surveys are very, very brief in Sport 2. Because the topic is rather narrow. So here we're talking about a moderate aerobic physical activity or physical activity. And the first question is in the screening survey. And by the way, Sport 2 is like all Prevention Plus Wellness programs. There's 3 components to the program. You screen youth or young adults for their current health habits, a range of both substance use and wellness habits. Secondly, you provide feedback about those behaviors. And using positive image terminology, you discuss the benefits of that wellness behavior, particularly desired positive future images of themselves. That increases motivation for change among the youth. And then you capitalize on that. And by giving them an opportunity to set goals, to increase self-regulation skills, to move forward with actually changing their lifestyle, not just avoiding substance use, but also increasing one or more protective behaviors. Screening, feedback, goal setting, it's a single session intervention. In this case, you've got up to 6 opportunities for screening and brief intervention. So question 1, what moderate physical activities did you participate in during the last 12 months, going back a whole year? Those types of activities, sports and chores that increase your breathing, heart rate, but not so much that makes you unable to talk while you're doing them. Check off all that applies. So there's a long list. Even under O, they could list some more. And then very unlikely they could even check that they've done none of those chores or activities. Question number 2, on most days of the week, do you engage in moderate physical activity for at least 30 minutes a day? So that's a regular moderate physical activity question. That's just it. That's it. They're just 2 questions. So it's very, very brief screening survey for moderate physical activity. The following questions are the pre-test. So if you want to do a pre-test before your Sport 2 Prevention Plus Wellness Program, and at the end of your 6 lessons, you can provide this pre-test and this post-test. We talked about that before. I'm just going to skim through that, through those items. So let's go right to the script. So this is the script for what we would call coaching script. Another term for that is the individual or the one-on-one script. So this is where you would sit down with an individual youth and provide this one-on-one. Now, remember, originally all Prevention Plus Wellness programs were designed to be implemented one-on-one. Then we expanded that to a script to provide them in a group setting. And the more recent iteration, which we just put on our website, is we're providing protocols and tools to provide these programs to youth by distance learning. So originally, you sit down with the youth either individually or in a group. Now, because of what's going on in our lives, we're modifying these protocols and these scripts so that you can provide your prevention plus wellness programs, whether it's Sport 2, Sport in Shape, in God's Image, whatever. We're providing modifications so that you could implement these by distance learning, particularly live online to your youth, either individually or in mass, and by phone, either individually or in a group. So those are the two main options. As well, we are offering some tools to provide recorded sessions and correspondence course. But anyway, let's take a look at the one-on-one script, the individual script, or what we call it in Sport 2, a coaching script. So you got an introduction. So you're going to say hi to that individual youth, and then you're going to say that you're going to give your name, and you say that you're the personal wellness instructor. By the way, you could use any title, and just an introduction and telling them what to do. Notice you show that first slide. So that's an introductory slide. So if you show this one-on-one, you could show a slide. How are you going to do that? You have to think about that. If you're face-to-face, are you going to show the slide on the wall, on a laptop, on a tablet? Are you going to make a flip chart? If you do a distance learning, your software, and by the way, we'll discuss this more in tomorrow's training, your software will likely allow you to show data or content, and so you'll be able to show your slides while you present this to your individual or your groups of youth online. Or now by phone, you don't have that luxury, but there's ways to get around that, which we will talk about also next tomorrow's training. So you have an introduction, and then you're going to ask them to complete that 2-item screening survey, and maybe even the pre-test if you want to do a pre and post test. And then you provide personalized feedback. So if they said yes, they got some physical activity last year, or they engage in regular physical activity, that's a moderate version, or they said yes to both, you're going to provide this response, the yes response. Congratulations. Getting moderate intensity physical activity, especially on most days of the week for at least 30 minutes, is critical to being fit and active. So what we do in this program is we bold those image terms, those vivid terminology that cues or triggers positive images unconsciously in the mind of young people. They already have them there, and you use these image terms, and that triggers them, and that increases motivation for change. So either yes, they got physical activity, and you provide the tailored response, congratulations, or they said no to both of the items. They didn't get any physical activity and not regularly, and you read the no response, which is getting moderate intensity physical activity will make you look and feel more fit and active. Set a goal to start getting 30 minutes of physical activity on most days a week. So like all of our programs, we provide a tailored response. It's either positive, congratulations, good for you, you're doing this, you're avoiding that, or it's a neutral response. You know, it doesn't appear like you're getting physical activity, but it's an opportunity to improve yourself. So that's what you get. You have this tailored feedback, either to the first item, and then you say yes, you say no, and then after that, you're going to show a slide, and you're going to provide content on positive behavior image coaching, or what we would call benefits and positive images associated with that wellness behavior. Remember, the wellness behavior is moderate physical activity. So you can see the script, you just read it. It's regular moderate physical activity is key to looking attractive, strong, physically fit. So lots and lots of vivid image terms, but also other benefits, sleeping better, controlling and losing weight, and so forth. So a lot of content there on that slide. And then in fact, there's so much content, it continues for, there's 2 slides, actually, 2 slides of positive image and benefit content. Then after that, there's a slide on risk behavior, how substance use interferes with this positive wellness behavior images and outcomes. So for example, you show the slide and you read alcohol, cigarette, and drug use interferes with living an active lifestyle and being physically fit. Substance use can harm your motivation to exercise regularly and so forth. So you're linking substance use as being counterproductive. And then lastly, you're going to have a recommendation. We call it a coaching recommendation. As your instructor, I recommend that you stay away from alcohol, cigarettes, drug use, and get 30 minutes of moderate physical activity. And then we're going to link it to being physically active, fit, and in shape. And then you go from that to the goal plan. Okay, so just like very much the same sequence and three-step process for all Prevention Plus Wellness programs. Now let's take a look at the goal plan. So, oh, by the way, before we look at the goal plan, let's compare this one-on-one script with the group script. So let's say you want to present this to your group, either face-to-face or to a group of youth online or by phone. You would use this script. And so you're going to say hi to the group, and you're going to introduce the program. You're going to show the same introductory slide. You're going to have the group complete the screening survey, and then you're going to provide feedback to the group about which of these moderate physical activities they participated in. If you could see them, you can have them raise their hands. You can have them respond verbally. You can have them respond on live chat. We'll talk about that in our distance learning training tomorrow if you are a part of that. And then you just continue on. Here's the, you're just going to assume in this case, in the group, that for the most part, youth are doing the right thing. So you're going to say congratulations for getting some physical activity. Then you're going to highlight the positive outcomes and images associated with moderate physical activity, same two slides. Then you're going to show how alcohol, tobacco, drug use interferes with moderate physical activity, and you're going to have a recommendation for them to avoid substance use and engage in moderate physical activity. So you can implement your program to one individual, to a group of individuals. You can implement it to them face-to-face. And we, as I mentioned, we've just loaded onto our website under preventionpluswellness.com under programs, a new resource for everyone. If you have our Prevention Plus Wellness programs, the resource is our adjusted slides and step-by-step protocols and a built-in goal setting so that you can provide your Prevention Plus Wellness program online or by telephone. So that's a brand new thing. So if you order a new program, that you've not had a program before, you'll have the new digital download. If you already have a program, to save you money, we're just going to offer just the digital download. So, and remember, the training for this is free, and we're starting with that training tomorrow, and we'll have another training on Wednesday. Let's take a look at the goal plan for the moderate physical activity. So you have an opportunity to set goals. A young person does, either as a group or individually. And what moderate physical activities will you do in the next week or in the next check all that you will do next each week. So I guess you could set the goal for next week or next month. So they get to check off moderate physical activity, but then there's more there. They get to identify specifics of that goal. How many days, what days a week, for how long, where, and with whom. Then there's a signature sign off by them and you as the instructor or somebody else in their life. And then there's a concluding statement with directions as to what to do with that goal setting contract. So that's sport 2. And it just goes on from there. It's same kind of thing, except it's addressing, the other lessons are addressing vigorous aerobic physical activity, muscle strengthening physical activity, nutrition. Let me just show you nutrition, for example, just to give you a little contrast of the content. When we get to nutrition, just to show you what content is being covered. And again, this is a great program. All of our programs are, but this has lots of extra content. So for nutrition, notice, look at what we're covering in the screening survey. Oops. Here we go. So we've got, are you eating 5 or more fruits and vegetables? Are you eating mostly healthy foods? And then that's described. And then you'll see what I'm talking about when you get to the goal plan, what you're giving them a chance to do. They get to identify what fruits they're going to eat. What vegetables do they want to eat? Look at the list there. They'll probably see some fruits and vegetables they've never even heard of. What other healthy foods do they want to eat? And again, they set that goal very specifically in terms of number of servings, how many days, where and when. So really, really good concrete goal setting. So that's the Sport 2 program. Let's take a look at the slide just to give you a little bit better sense of the content as shown in the slides. So here's the cover slide, and then this is the and again, this is set up in a sequence, but you're welcome to use you don't have to use all 6 of these lessons, and then we will cover this in our online training if you do want to implement this. But let's say you're providing the lesson on moderate physical activity. There's the directions for completing the screening survey. There's the 2 questions, question 1, question 2. That's it. And then there's even the pre-test questions if you want to include those. And then here's the content. There's the introductory slide. That's where you provide the personalized feedback. And then there's a couple of slides on the benefits of moderate physical activity, or it could be nutrition or stress control. There's a little bit more content there, that usually a couple of slides. Then how substance use, alcohol, tobacco, drug use interferes with that wellness behavior. And then there's a recommendation. And then that's it. Then you go right on to lesson number 2 and so forth. So that's what the slides look like. And you're able to tailor these slides if you want to put different images in there. We cover all of that on our online program implementer training, 2-hour live training. If you want to order it, go to our website, preventionpluswellness.com, and go to training, click on it. And if you log in the code 15% off, you'll get 50% off that training. One more thing I'd like to show you is just so that you know where it's at, for those of you that weren't on our training yesterday. I was going to show you our website. So let me just stop the training right now and see if I can pull up our website. And I'll show you that, and then we're done. That's all. I just want to give you a little peek at our website, and then we could open it up. If anybody has any questions, comments, I'm happy to stay as long as you'd like. Remember, what I'm going to do is I'm going to follow up and send everybody who's registered for this training a link to the recorded session. This recorded training, you're welcome to, and I encourage you to share it widely among your colleagues throughout the region and state, and then also a certificate for half-hour CEU. So here it is, lots of good stuff. Programs. There's our new online PPW program downloads. This is to provide Prevention Plus Wellness programs online. So then we have our training. This is where you could order the first item, online program implementer training, 2 hours live, if you want to have more in-depth training in any of our Prevention Plus Wellness programs. This more categories where you have a bunch of free resources. Even if you don't use our programs, there's free resources for you as a prevention and health specialist. Don't forget our news and our blogs right here, lots and lots of good content. So that's it. I'm going to stop at this point, see if anybody has any questions and comments, and you just can write those in the live chat. And it looks like there's a number of things that people have written. I'm going to go back and see what people have said and see if there's anything I can help with. Audio is working. I could hear you. That's good news. People are saying hi, hello to everybody who have signed in. Thank you for your prayers for Brittany. I appreciate that, and thanks for listening to that. God bless you guys for all you do for your youth, for your families, and I hope you all maintain safety and continue to be safe and healthy wherever you're at. Take care of yourselves during this, because it's a very stressful time. Make sure you are eating well, exercising, getting plenty of sleep, practicing stress management, because it is a very stressful time because of the change and the sense that we don't have control over, which we don't really have control over anything. So if you can come to grips with that, I think that's a very healthy attitude. So thank you for your prayers. I'm looking at the comments, seeing if there's anything I could respond to. Oh, okay. Those are some comments about going back to the introductory poll that so let me go to the back of these and see if there's any questions. So somebody responded, Rose, my organization has, students really enjoyed it. I'm not sure what that means. Praying for Brittany. Thank you guys. You are so generous. I use Sport 2, 10th graders in school setting. Has anyone on this call used this with high school students? Have you used this with schools or youth organizations? So you're welcome to respond to that question. I could just say that the Sport 2 is being used in school, out of school settings, like all of our programs, after school, Boys and Girls Club, youth groups, and very, very good responses. Kids love it, lots of good content. Remember, you're giving them an opportunity to stop and think and reflect about their own health habits. Then you're going to motivate them to improve, to want to change their lives and improve their lives and improve themselves and how they feel and look about themselves. And then you're going to help them start developing some self-control skills, which are so essential to young people, all young people, and especially high-risk young people. And then this is a skill that they can use for the rest of their lives, this goal setting. Really, really good stuff for young people. So I've heard nothing. I'm biased, obviously, but I've heard nothing but very, very good. So, for example, in West Virginia, that was the program that they liked the most of all of our programs. They really, really enjoyed it. They wanted more content, and so the Sport 2 program ended up being very positive for them, and the program of choice of Prevention Plus Wellness program. Remember, all these programs are very unique. They integrate avoidance of substance use with the promotion of youth development, of wellness, of protective wellness behaviors. You don't see this in other programs. This is a very, very unique, holistic youth development approach, and it could be implemented to youth of any age. We've got programs from children all the way to young adults. And you could now do this not just face-to-face, but through distance alerting strategies, and more about that tomorrow if you do sign in for tomorrow's training on distance learning strategies, particularly online and by phone. Remember, if you don't get in tomorrow, because we're way, way, way overbooked on this, we do have another session coming up on Wednesday. So I'll contact you if you don't get in tomorrow's session. No worries. I will send everybody an email with a link so you can get in Wednesday, and we'll offer as many of these free sessions as possible so that you could learn how to provide our programs if you have them already. And if you don't, you can at least learn how they could be implemented. Maybe that would be instructive for you just generally as a prevention specialist. So let me go back, see if there's any other questions or comments. Is there a way to get recommendations from previous places that have used the programs so that we can present that success to our district? So yes, if you'll email me, I could see what I could do for you there. Just send us an email at info, I-N-F-O, at preventionpluswellness.com. That's all spelled out. And I bet you I could send you certainly a contact from the West Virginia people, because they loved it. And I will share with you some links with some material like a brochure, one-page flyer, and some other things that you can use to share with others. And by the way, if you want to see a sample, a redacted sample of this program or any of our programs, you could simply send us that request. So, and we'll be happy to email you a link to look at the program. So that could be any of our programs. So you can do that two ways. You could just send me an email directly to info@preventionpluswellness.com, or you can go to our website, preventionpluswellness.com, and then on there, there's a link to request a sample of our program. Whatever is easier, just let us know. We're happy to send you a sample of the Sport 2, high school, middle school, elementary, whatever, or any of our programs. Okay, great questions, great feedback, wonderful heartfelt responses for Britt. And I hope you guys are safe and taking care of yourself and continuing to do good work. If there's anything I can do, let me know. There's another question here. Is there a way to get a recommendation? Oh, here we go. Thank you again, Dr. Wirtz. Thank you very much for being here. Stay safe. Have a great afternoon. God bless you all. And I hope you keep providing those essential prevention programs, content strategies to your youth and young adults. Figure out how to do it. If there's some way we can help, let us know. Go to our website and see if there's some materials that you might find that can help you. And we'll continue to provide these free webinars. And if we hear back from you, you need something else, we listen. So let me know if we can help. Thank you, guys. Bye-bye.